Many men develop metabolic dysfunction long before they realize anything is wrong.
One of the most misunderstood aspects of metabolic health is how quietly it changes. Most people expect clear warning signs. They expect something dramatic. But early metabolic dysfunction rarely announces itself that way. Instead, it develops gradually, often while blood tests still appear normal and daily routines remain unchanged. In the early stages, the body compensates. Regulation becomes less efficient, but function is preserved. Energy is still adequate most of the time. Weight may remain stable. Daily performance appears normal. This compensation masks underlying change. The body adjusts internally to maintain outward stability. As long as compensation is sufficient, symptoms remain subtle. This creates the impression that nothing is wrong. This is why early metabolic dysfunction is so often missed. One of the first changes is increased variability. Energy feels less predictable across the day. Some days feel normal, while others feel unexpectedly flat or drained without a clear cause. These fluctuations are not random. They reflect a system that is becoming less resilient. Hunger patterns may shift as well. Appetite becomes less consistent. Some meals feel satisfying, while others leave a lingering sense of incompleteness. This is not increased appetite. It is reduced signal precision. The body is still communicating, but the messages are less clear. Recovery also changes early. After physical or mental effort, the body takes longer to return to baseline. Fatigue lingers slightly longer than it used to. Sleep may still be adequate in duration, yet feel less restorative. These shifts are subtle. Individually, they are easy to rationalize. Together, they reflect reduced buffering capacity. Another early sign is increased sensitivity to disruption. Small stressors produce larger effects. A poor night of sleep has a noticeable impact on energy the next day. A missed meal feels more uncomfortable than expected. This increased sensitivity reflects declining metabolic flexibility. The body still functions, but it has less margin for error. At this stage, fat gain may not be obvious. Body weight may remain stable, but fat distribution begins to change slowly. Clothing fits differently before the scale changes. These are early structural signals, not failures of behavior. Importantly, standard blood markers often remain within reference ranges during this phase. Fasting glucose, cholesterol, and other values may appear normal. This creates a false sense of reassurance. Reference ranges are designed to detect disease, not early dysfunction. They reflect population averages, not optimal regulation. Because of this, early metabolic changes are often attributed to stress, aging, or lifestyle busyness. While these factors influence metabolism, they do not fully explain what is happening internally. What is changing is regulation, not motivation. As flexibility declines, the body relies more heavily on external input to maintain stability. Eating becomes a way to manage energy rather than respond to hunger. Rest becomes less restorative. Effort feels more costly. Yet, because the body is still functioning, these changes are easy to normalize. This is the phase where many men begin adapting around the problem instead of recognizing it. They structure their day to avoid energy dips. They compensate for fatigue with stimulation. They rely on routine rather than responsiveness. These adjustments preserve function in the short term, but they deepen reliance on compensation rather than restoring regulation. Understanding early dysfunction matters because it reframes the timeline. Metabolic problems do not appear suddenly. They accumulate quietly over years. By the time fat gain, fatigue, or insulin resistance become obvious, the system has already been adapting for a long time. Recognizing this early phase helps explain why later change feels difficult. The system is not suddenly resistant. It has been gradually constraining itself. In the next video, I will explain why blood tests can look normal even when metabolic regulation is already impaired, and what those tests do and do not measure. On this channel, I explain metabolism using medical science. This video is for educational purposes only. This is not medical advice. Always consult your physician.